this is Dr. Wells with Wells Medicine, and I wanted to talk about progesterone today. Progesterone is magic for women going through perimenopause and menopause and having anxiety and sleeplessness. So we make progesterone throughout our adult lives, and it starts decreasing as we get into our late 30s and early 40s. And this is around the time that a lot of women will start experiencing anxiety and sleeplessness. And there really isn't a good test for progesterone. You can get your levels drawn, but those can be confusing to read and interpret. Progesterone itself has very few side effects. It is not the same medication as the progestins that are found in birth control pills. So progesterone is a naturally derived chemical. Progestins are synthetic. There are very different side effects between the two medications. And a lot of women who have trouble with birth control actually are having trouble with the progestins, not the progesterone. They use progesterone in perimenopausal and menopausal women, but also in early pregnancy to help maintain fetal development and prevent miscarriage. So a lot of women will already have had experience using progesterone during that. And a lot of people experience progesterone as, gosh, I was so relaxed when I was pregnant. I had such better sleep when I was pregnant. I just didn't have anxiety. Or when they're taking it for IVF, they'll notice those things as well. And it is a very, very cheap generic medication. It comes in 2 doses, 100s and 200s. For women in kind of their 40 and beyond, if you're having trouble sleeping, if you're having a lot of anxiety, my best suggestion is to see if your provider will prescribe you. It's not a controlled substance. There's no addictive potential. Prescribe you either the 100s or the 200s. Try them at night before you go to bed. You can even bite the little capsule and take 50 if you want to just kind of test, dip your toe in the water. Try the 100s, try the 200s, see how you're feeling after a month. You don't have to stay on this medication for the rest of your life if you don't like it or if you're experiencing some side effects. But if you're one of the majority of women who feel dramatically better on a little bit of progesterone in your 40s and beyond, to help with sleep, to help with anxiety, it's well worth a try. And it can be a huge game changer, along with some other sleep hygiene things and some other supplements. It's certainly not the only thing. And I love, my estrogen and my testosterone too. But progesterone is highly underrated. I can't tell you how many patients I see come in with a menopause-aware doctor who are receiving estrogen, maybe even testosterone, but because they don't have a uterus anymore and the progesterone isn't a required part of postmenopausal hormone replacement therapy, they're not put on progesterone. And I think that's a real shame, because even if you don't have a uterus and you don't need progesterone for the uterine protection benefits of taking estrogen in peri and postmenopause, I think people are really missing out if they're not trying progesterone. So just my little 2 cents and I certainly don't make any money on this, very cheap generic drug, but I think it can really help people feel significantly better. So my little 2 cents on just asking for a progesterone prescription and dipping your toe in the water and trying it.